Let us now go to general adult tests. The topic is exercise electrocardiogram. An exercise electrocardiogram, or ECG, is a graphical recording of the electrical activity of your heart while you exercise. Exercise causes your heart to beat faster, and this test can see how your heart copes with the increased workload. This test detects changes in the heart's electrical activity that may only become apparent when your heart speeds up, such as during exercise or when under stress. For this reason, it is also known as a stress test. It can be used to find a cause for symptoms such as breathlessness, chest pain, or palpitations that occur when you exert yourself. This test is usually only recommended if your doctor is concerned about your heart. It is also used to check your heart after a heart attack or heart procedure. This test requires you to walk on a moving treadmill that gradually gets faster and steeper over about 10 minutes. Occasionally, you may be asked to pedal a stationary bike instead. You will be connected to an ECG machine via sticky pads on your chest and also have your blood pressure and heart rate monitored. It is not a competition, and the test will be stopped if you complain of chest pain, shortness of breath, feeling unwell, or if there are certain changes on your ECG tracing. If you are not able to do the exercise required, there are other tests such as a nuclear scan, which can provide similar information to the exercise ECG. Your exercise ECG tracing may be normal, which can be very reassuring for you. However, it may also show changes that suggest you may have reduced blood flow to your heart muscle. This can be due to narrowing in the arteries supplying your heart. In this case, your doctor will recommend that you have further tests to look at these blood vessels in more detail. During an exercise ECG, the intensity of the activity will increase until you reach a target heart rate set by your doctor. This may be 85% of your maximum heart rate. Once you've reached your target heart rate, the intensity is gradually decreased so that you cool down rather than stopping abruptly. Thank you so much for your attention.
Let's now go to pathology. Let's discuss internal pathogenic factors. Internal pathogenic factors. Internal pathogenic factors are either internally generated, example, phlegm deriving from a spleen and kidney deficiency, or a transformation of an external pathogenic factor. In only 3 cases can an external pathogenic factor penetrate the interior from the beginning without going through an exterior stage, thus becoming internal pathogenic factors as soon as they invade the body. This happens in invasions of cold in the stomach, like acute epigastric pain and vomiting, in intestines, acute abdominal pain and diarrhea, and uterus, an acute dysmenorrhea. In only 3 cases does an external pathogenic factor penetrate the body's interior from the beginning without causing exterior symptoms, like invasion of cold in the stomach, invasion of cold in the intestines, and invasion of cold in the uterus. Interior pathogenic factors are internally generated. That is, they form because of an internal disharmony. For example, a deficiency of the lungs, spleen, and kidneys may give rise to phlegm. A deficiency of yang may lead to empty cold. A deficiency of the spleen may lead to dampness. As you can see in the examples of external pathogenic factors are chi stagnation, blood stasis, internal wind, internal dampness, internal cold, phlegm, heat, and fire. Thank you for your attention. Let's now go to Foot Yang Ming stomach meridian. Stomach 10, water rushing out. In the Foot Yang Ming stomach meridian, the stomach 10 is located at the anterior margin of the sternocleidomastoid muscle at the level of upper border of cricoid cartilage. Stomach 10, water rushing out, water prominence, water gate, water heaven. This point can free the passage of lung qi, rectifying and adjusting it back onto the correct path. This freeing disinhibits the throat and clear cough and sore throat. mainly used locally. The name may refer to the proximity of the carotid artery. Local point for tonsillitis, pharyngitis, or bronchitis. The location on the anterior border of the sternocleidomastoid muscle at the midpoint of a line connecting stomach 9 and stomach 11. To find, stomach 9 and stomach 10 are both located on the anterior border of the sternocleidomastoid muscle. Stomach 11 is located posterior to the sternal head. Place the middle finger of the left hand onto stomach 9 on the level of the laryngeal prominence and the thumb on stomach 11, posterior to the sternal insertion. Stomach 10 is located at the midpoint between the two fingers. With the patient's head rotated in the opposite direction, the muscle will be more visible and can be more easily palpated. For needling, 0.5 to 1 con obliquely in a medial direction away from the artery. Caution: the carotid artery jugular veins, if necessary, rotate the head back to a middle position before needling. For actions, indications, regulates the lung qi and benefits the throat. Thank you for your attention.
Let's discuss liver patterns, liver constraint. Concept: this is due to deficient condition of the liver function, leading to wood not controlling earth. Lack of liver function leads to stagnation, which may lead to internal heat, and if this affects blood, then blood stasis may also result. Clinical manifestations: stuffiness and suffocating feeling in the chest, and hypochondrium or lower abdomen. Depression and unhappiness. Dysmenorrhea, abnormal menstruation, amenorrhea, sighing, globus hystericus, or plumstone throat. Subjective feeling of lump or obstruction in the throat. Goiter, abdominal masses, digestive problems, stabbing intestine pains, if blood stasis is involved. Key symptoms: stuffiness in the chest, depression, and menstrual problem. Here the analysis of liver constraint pattern. Liver fails to maintain the smooth flow of qi, and free flow of qi is depressed and becomes stagnated. There is stuffiness and fullness in the chest and hypochondrium or lower abdomen, wandering pain in the chest. There's depression, sighing. Next, there is disharmony of qi and blood impairing the chongmai and ranmai. Dysmenorrhea, abnormal menstruation, amenorrhea. The standing pain in the breast. Qi unable to transport fluids, then accumulates to form phlegm. Intermingled phlegm and qi. In the throat, there is globus hystericus. In the neck, there is goiter. Depressed qi transforms into fire, endures fluid to form phlegm. Stagnation in the liver channel, there is abdominal mass. Long-standing qi stagnation leading to blood stasis. For the summary: stagnation, binding, depression, and liver qi. Etiology: there is prolonged emotional disturbance like a state of frustration, repressed anger, or resentment over a long period. Underlying accompanying pathology: kidney deficiency, liver blood deficiency, spleen qi deficiency. Signs and symptoms: melancholy, depression, moodiness, hypochondrial, epigastric distension, feeling of oppression of the chest, sighing, irritability, premenstrual tension, irregular periods, premenstrual breast distension, plumstone throat, jaundice, epilepsy. The pulse is wiry, tongue normal or slightly red, sides. Treatment principle is force liver qi, rectify qi, resolve depression, harmonize liver and spleen, stomach. Acupuncture treatment: we use PC6, regulates liver qi. Liver 13 harmonizes liver and spleen. Liver 3 forces the liver qi. Bladder 18 disperses liver stasis. GB34 forces liver qi. Liver 14 harmonizes liver and stomach. Sanjiao 6 regulates liver, eases hypochondrium. For mental depression, we use heart 7, do 26. For oppression in the chest, we use REN 17. For pain and distension in the lower abdomen, liver 5, liver 6. Tongue stone throat, REN 17, PC 5, REN 22. Breast pain, REN 17, liver 14. Needle with Eman method, moxa may be used. Relevant advice when there's liver qi stagnation, it is best whenever possible to address and work with any mental emotional factors that can lead to liver qi stagnating. Stress should be avoided. Physical activity is beneficial because it circulates qi and thereby spreads liver qi. People whose liver qi stagnates often train a lot or work out. This is a form of self-medication when they consciously or subconsciously try to relieve or prevent their symptoms. The danger is, though, that some people begin to train excessively and damages the blood and yin as a consequence. A person whose liver qi stagnates should possibly be wary of playing competitive sports because the competition aspect may aggravate their condition when they lose or when their teammates do not do what they think they should. Dancing, aerobics, running, swimming, or cycling are good options because they can dynamically activate and circulate qi. Gentler forms of movement such as Tai Chi, Qigong, and Yoga are also salutary because they help Qi to flow. But this can be perceived as being too slow and boring for people when there is a liver Qi stagnation. The resulting frustration and impatience can aggravate the liver Qi stagnation. More dynamic activities are therefore often a better idea, at least in the beginning. Dancing will be a particularly good way to physically activate liver qi because it is usually a pleasurable activity and will therefore simultaneously nourishes the heart. It is very important that activities in which the person engages do not feel like things that have to be done, thereby becoming a source of frustration and further stagnating the person's liver qi. Shouting or singing are good ways to spread liver qi, especially because singing is pleasurable and thereby also nourishes the heart qi. It can be a good idea to incorporate physical activity into the daily routine, for example, by cycling or walking to work instead of driving, taking the stairs instead of the elevator, getting off the bus a stop earlier and walking in the last part of the journey. Breathing exercises that involve slowly inhaling deeply and then quickly exhaling with force while making a loud noise will help to release stagnant qi. A person whose liver qi stagnates should try to avoid eating too much at one time or eating rich food, especially concentrated proteins such as meat, dairy products, nuts, and food that has high oil content because this will create further stagnation. Aromatic spices, herbs, and foods that are slightly spicy will move qi. Care must be taken if these also have a warm or hot energy because qi stagnations tend to create heat. Unfortunately, people with liver qi stagnation are often attracted to alcohol and spices, such as chili, precisely because their spicy flavor spreads the stagnant qi. Unfortunately, this often results in the generation of heat. Going for a walk Walk after eating will help to circulate qi in the body. A teaspoon of vinegar or lemon juice and a teaspoon of honey in a glass of warm water will help to temporarily relieve liver qi stagnation. Thank you for your attention. Let's discuss inquiring pain. When inquiring about pain, pay attention to the quality and location of the pain. First, the quality of pain, distending pain. Distending pain in the chest, abdomen, or flanks suggests stagnation of qi. Distending pain in the head or eyes suggests flaming upward of liver fire or abdominal ascent of liver yang. Stabbing pain, this is a sign of blood stasis. Cold pain, this is pain associated with the sensation of coldness and alleviated by warming. It is mostly due to the cold evil in the meridians or deficiency of yang qi causing loss of warmth. Burning pain, this is pain associated with feverishness and alleviated by cooling. It is mostly due to strong yang heat or endogenous heat due to yin deficiency. Colicky pain, this is spasmodic pain and is mostly due to strong disease evil blocking the meridians. It is a sign that the illness is one of strength. Next is dull pain. The pain is less intense but persistent. It is mostly due to deficiency of yin blood or insufficiency of yang qi, so that the visceral organs lose their nourishment. It is a sign that the illness is one of deficiency. Next, heavy pain. This is pain accompanied by sensation of heaviness. It is mainly due to dampness blocking the meridians so that the qi cannot move freely. Next, aching pain. Here the pain is more of quality of aches with associated weakness. Total body aching pain is seen in illness in the exterior or of dampness. Lumbar and knee aches are mostly due to kidney insufficiency. Next, hollow pain. It is pain associated with the sensation of emptiness. It is mainly due to deficiency of qi and blood, so that essence and marrow become deficient and the organ system lose their nourishment. Next, location of pain. Migratory pain in the joints suggests rheumatism. Migratory pain in the chest, flanks, and abdomen suggests qi blockage. Fixed pain, this is pain that is fixed in location. If it is in the joints of the limbs, it is called palsy. It is in the interior, it suggests blood stasis. Next, headache. The precise location of the headache can indicate the meridian involved in the illness. Frontal pain across the superciliary ridges is in the yang min. Temporal pain on both sides is in xiaoyang. Occipital pain is in taiyang. Taiyang. Pain in the vertex of the head is zhouyin. Depending on the quality of the pain, it is accompanying symptoms. And its accompanying symptoms, it is possible to differentiate between exogenous illness and internal injury, between deficiency in strength, and between cold and heat. Severe and persistent headache accompanied by total body aches, cold intolerance, and fever is mostly due to exogenous illness. Strong pain in the vertex is aggravated by wind or cold is due to wind cold. In a patient preferring cold things, headache that is aggravated by wind or heat is due to wind heat. Headaches that feels that though the head is being tightly bound and being weighed down with heaviness in the limbs and body is due to wind dampness. Milder but persistent headache with frequent remission is mostly due to internal illness. Dull headache is associated with over-fatigue, is due to Qi deficiency, but dull headache associated with dizziness and facial pallor is due to blood insufficiency. Hollow headache, as though the skull is empty, associated with lumbar and knee aches and weakness, is due to insufficiency of the kidney. Headaches with associated heaviness in the head, abdominal distension, and loose faces is due to spleen insufficiency. Stabbing headache in fixed location is due to blood stasis. Headache as though the head is being tightly bound and accompanied by chest tightness and greasy tongue coating is due to turbid phlegm. But if accompanied by bitter taste and dry throat, it is due to flaming upward of liver fire. Thank you for your attention.
Let us now go to interview and history taking strategies. The topic is types of health histories. Health histories are of two types, comprehensive and focused. A comprehensive health history should be performed on all non-emergent new patients who will be receiving ongoing primary care from a particular provider or group of clinicians. Comprehensive health histories contain all of the following elements. First is patient identifiers. These include name, gender, age, ethnicity, occupation, source of referral, and date and time of the clinical encounter. Next is reliability. It is particularly critical to assess the reliability of the individual providing the historical data. In most instances, it will be the actual patient. However, in some clinical situations, a person other than the patient will provide all or most of the data. It is imperative that the clinician identifies the source of the data and records their judgment about the reliability of the information provided. For example, a clinician might record the following statement. Reliability. Patient has difficulty describing the severity and progression of his symptoms and uses contradictory terms to describe the character of the chest pain. In some situations, assessment of the reliability of the information is complicated by language barriers. When a translator is required, the clinician should address questions to the patient or caregiver and not the translator, and should allow adequate time for the translator to reformulate the questions for the patient. Additional factors may influence the reliability of the information presented, including such patient or informant emotions as fear and shame. The clinician should try to create a supportive, non-judgmental interviewing environment, which will encourage full disclosure of health and social information by the patient. Next is chief complaint. This term reflects a medical or problem-oriented focus to care. Many patients seek care for health maintenance or disease prevention reasons. A more encompassing term is reason for seeking care. There's also history of present illness, or HPI, past medical history, PMI, and family history, social history, and review of systems. A focused health history is performed in emergency situations or when the patient is already under the ongoing care of the clinician and presents with a specific problem-oriented complaint. Focus histories include identifying data, chief complaint, history of present illness, data from the patient's past medical history, family history, social history that are pertinent to the chief complaint, and problem-oriented review of systems. For example, a known adult patient complaining of substernal or epigastric pain would be asked questions related to the cardiovascular, respiratory, musculoskeletal, and gastrointestinal systems. Focusing attention on these systems would help the clinician to formulate and prioritize differential diagnoses based on the most likely origin of the patient's symptoms. Thank you so much for your attention.
Let's now go to 5-element constitutional acupuncture. Let's discuss element points 2. The position of element points. The element points are sited on the limbs. All nail points on the yin channels are wood points. The second points are fire points, and the third points are earth points. Points at the elbows or knees are water points. Metal points vary slightly in their position, but naturally lie between the earth and the water points. All nail points on the yang channels are metal points. The second points are water points, and the third points, except for gallbladder, are wood points. Wood points at the elbows or knees are earth points. Fire points lie between the wood and earth points and can vary in their positions. The concept of transferring qi between organs. The idea of transferring qi from an organ that is in excess relative to another organ is extremely old in Chinese medicine. The Maishu, recently excavated at the Zhangjiashan burial site and probably the earliest extant treatise on acupuncture, states, those who treat illness take the surplus and supplement of insufficiency. It is mentioned in Su Wen, chapter 5, that if there is a qi deficiency in a particular location or channel, the qi can be conducted or guided from other channels to supplement the weakness. Su Wen, however, gives no specific treatment protocols for the process of transferring qi. In the Ming Dynasty, Xu Feng and Gao Wu set out the use of tonification and sedation points. This led to these treatment protocols becoming widely used, especially amongst Korean and Japanese acupuncturists. The importance of harmonizing qi of the 12 organs is fundamental in this style of acupuncture. This means that it is common practice to transfer qi between organs, even if the relatively stronger organ is somewhat deficient in absolute terms. Pulse diagnosis is crucial in making this judgment. For tonification points, the tonification point on a channel is the point associated with the preceding element on the Sheng cycle, the mother of the organ involved. Tonifying these points transfers qi from the mother organ to the child. Qi can only be transferred from a yin organ to another yin organ, or a yang organ to another yang organ. For example, bladder 67, the metal point of the bladder channel can be used to pull qi from the large intestine into the bladder, or kidney 7, the metal point of the kidney, to transfer qi from the lung to the kidneys. The tonification points are lung 9, large intestine 11, stomach 41, spleen 2, heart 9, small intestine 3, bladder 67, kidney 7, point associated with the following element on the Sheng cycle, or the child of the organ involved. The sedation point on the channel is sedated if the qi in an organ is in relative excess compared to that of the organ that follows it on the Sheng cycle. For example, stomach 45, the metal point can be sedated if the practitioner wishes to transfer qi to the large intestine. The sedation points are lung 5, large intestine 2, stomach 45, spleen 5, heart 7, small intestine 8, bladder 65, kidney 1, pericardium 7, triple burner 10, gallbladder 38, and liver 2. Thank you for your attention. Let's now go to erectile dysfunction. Let's discuss the etiology in Chinese medicine. Etiology of erectile dysfunction in Chinese medicine are old age, excessive sexual activity, irregular diet, emotional stress, excessive physical activity, or overwork. In old age, as a man gets older, the kidney essence naturally declines and the fire of the gate of life, or Mingmen, gradually diminishes. It is in particular the decline of the fire of the gate of life that causes impotence in the elderly. Excessive sexual activity. Chinese books always mention excessive sexual activity as a cause of impotence. Excessive sexual activity causes a decline of both the kidney essence and the fire of the gate of life. The decline of the latter may cause impotence. Modern Chinese books always make a point of mentioning that excessive masturbation also constitutes excessive sexual activity. A level of sexual activity may be defined excessive only in relation to the man's age, Obviously, what is an excessive level of sexual activity in a 50-year-old man may be normal in a 20-year-old man. A very rough guideline is provided by dividing a man's age by 5 to indicate the frequency of sexual activity. For example, for a 40-year-old man, the ideal frequency would be once every 8 days. However, bear in mind this theory assumes that the man is in good health. Should he suffer from a kidney deficiency, the frequency should then be reduced. Finally, sexual activity in a man assumes ejaculation. That is, it is excessive frequency of ejaculation that weakens the kidneys, not sexual activity without ejaculation. Irregular diet. The excessive consumption of greasy, fried foods, and dairy foods may lead to dampness or phlegm. Both dampness and phlegm may affect the man's genital system and give rise to impotence. For emotional stress is an important cause of impotence in the patients we see in Western countries. All emotions may lead to chi stagnation, and this starts as a pathological process that later involves some heat and frequently dampness or phlegm. In particular, worry, grief, and sadness affect the spleen and heart and may lead to impotence from heart blood deficiency. Fear and anxiety affect the kidneys and may lead to impotence from kidney deficiency. Repressed anger and guilt may lead to chi stagnation and blood stasis, which may also cause erectile dysfunction. Excessive physical activity, which may include excessive running or weightlifting in gym workouts, weakens spleen and kidney yang and may lead to impotence from kidney deficiency. Overwork. Overwork is another very important cause of impotence in Western patients. Overwork is defined as working long hours without any rest for many years, usually as under conditions of stress. This weakens the kidney and particularly kidney yin and is important cause of impotence in middle-aged men. Thank you for your attention.